Our next speaker tonight is Gemma Daly. And Gemma is a Senior Principal Veterinary Officer with the Department of Agriculture, Environment and Rural Affairs in Northern Ireland, who I work very closely with. And Gemma qualified from the University of Liverpool in 2007 and worked for 5 years in mixed practice in Northern Ireland before she joined DAERA's veterinary service in 2012. She's worked in a number of roles, including field veterinary officer, agriculture education and training veterinary officer, and she currently works as the head of the contingency planning and exotic disease team, which is why I work very closely with her. She's also a member of the Board of Trustees of the Northern Ireland charity Rural Support. So as you're aware, diseases, especially viral ones, don't respect borders. So that is why Gemma and colleagues work so closely with ourselves in the National Disease Control Centre. And I am delighted to have Gemma here this evening to discuss African swine fever. So I'll hand over to you, Gemma, now. Thanks.
Thank you, June, for that introduction, and good evening, everyone. Can you see my screen and hear me okay, June?
I can indeed, yeah.
Perfect, thank you. So I'm delighted to have the opportunity to speak to you this evening and to give you a brief overview of the emerging threat of African swine fever and sort of preparedness we have on board for an outbreak of this disease. My talk will follow a similar format to that which Sunita gave on blue tongue. So we have heard from other speakers this evening about a number of other diseases that we've either experienced in the past or have seen emerging as new threats in recent years, and African swine fever is another one of those emerging threats. It's really the most important disease of pigs worldwide currently. As the name suggests, it originated in Africa and it largely remained there up until about 2007, where there was then an incursion of the virus into Europe. And really it's been moving steadily westward in Europe really since 2017, and that's really what's brought the increase in the threat to the pig industry within the UK and Ireland. In 2018, the virus also found its way to China, and it had a devastating impact on the pig industry there, and really was the world's leading pork-producing country, with millions of pigs killed as a result of the disease. And just back in July of 2021, the disease also made its way back to the Dominican Republic, and also more recently it was diagnosed in Haiti. So due to the finding of this virus towards the Western Hemisphere, you can understand that also the USA pig industry are also getting very nervous about the disease coming close to their shores as well. So it's really become a disease of global interest in recent years. But first I'll just take you through an overview of the disease itself and what it actually is. So African swine fever virus, it causes severe disease in pigs and in wild boar, and it's solely a disease of pigs, and it can result really in a death and high mortality in pigs that are infected. It's notifiable disease, so by law, if we suspect disease, it should be reported to the department to investigate further. There's no threat to human health, either in relation to direct contact or through food. There's no food safety issues with African swine fever. There's no treatment or vaccine available. And so the key message throughout my presentation will be about biosecurity and how biosecurity measures are really essential to prevent the disease getting into a herd and also to prevent it from spreading any further. Clinical signs of African swine fever vary greatly, and they can be similar to some other pig diseases, so it should always be there on the list of differentials. The signs can't be distinguished from that of classical swine fever, which is another virus that causes very similar signs, and they can only be determined in the laboratory, the difference between the two diseases. But signs that typically occur 3 to 15 days after they've met the virus and become infected by it. Early signs can be non-specific, so temperature, lethargy and off their food, loss of appetite, but you can get very high mortalities very quickly with the disease, with very little sign of disease building up to it. The pigs just die very suddenly. At later stages, you can get a range of other signs. You can get a huddling of the pigs together, you can have reddening of the skin, particularly around the tips of the ears, the tail and the feet, or the extremities of the body. There can be diarrhea and vomiting, abortions and stillbirths, and sort of increase in morbidity and not willing to get up. So a full range of signs across the spectrum, and we're seeing that from the cases particularly in China. They're getting the full spectrum of clinical signs with this disease. How is it spread? So direct contact between infected pigs or wild boar, particularly in countries that have wild boar, thankfully don't have any on the island of Ireland, in contact with feces or bodily fluids, and also through indirect contact through fomite spread. So that's things of people moving onto farms and carrying on their clothing, equipment and vehicles that aren't being effectively cleansed and disinfected between farms. So that's ineffective biosecurity. Pigs eating infected pig meat or meat products, and Philip alluded to it in his foot and mouth presentation. That's how foot and mouth was spread as well. So that is a key risk. African swine fever virus can live for a long time, hundreds of days, particularly in frozen pork products and pork meat. And that's the risk that, particularly how we might get into the island of Ireland, is through illegal pork meat coming into the country and getting onto pig farms. Biological vectors also play a role. So Anita talked about midges in relation to blue tongue. For African swine fever, it's that there's tick species involved, and thankfully, again, we don't have them in this country that can carry African swine fever, but there's still a risk to this country through the illegal import of infected pig meat. So again, just to show you a few maps of the current situation within Europe. So we have here are the purple dots relate to African swine fever in wild boar, and European countries have a lot of wild boar circulating in a few herds within forested areas. There also have the red dots, which are domestic pigs. And again, we find particularly in Eastern European countries, there's a lot of backyard pig herds. A lot of people have small holdings where they have pigs to feed the family. And once these get infected or in quite close contact with wild boar, we can see how the disease is perpetuating in those areas. The orange dots relate to commercial pig farms. So you can see that there have also been a number of large commercial pig farms being infected as well. And the biggest concern more recently last year was Germany had their first incidents in wild boar, and they've been trying their hardest to keep it out of their commercial pig holdings, but they are starting to see it now in domestic pig cases and commercial holdings. So that is the risk that it's really started in the Baltic states and spread because of the wild boar in connection with the small holdings, but it is spreading slowly westward, and that is the concern that will come to our shores more quickly than we would like to see it. In Europe, this is the EU map at the moment of where the restriction zones are. So again, this is the current state of play most recently in the EU. So again, we can see the German-Polish border there where we've had most recent cases. Within China then, again, similar dots across between, again, the wild boar, domestic pigs and large commercial premises, across China, Indonesia and South Korea as well have become infected with cases. And then these are the most recent cases that we have. I mentioned Dominican Republic and Haiti as well in their domestic pig population. So why is it important? Two main reasons why it's important to our pig industry is if we got disease in here, like foot and mouth, as Philip had described, the mass culling to try and get on top of the disease, the same would happen here. We have disease control measures put in place and the culling of pigs. Obviously, it's an exotic disease that comes in. Pig herds, the high mortality, it's certainly a risk to animal health and welfare. We don't want to see it here at all. The other large factor into ASF is the trade impact. If we get this disease into the country, the export buyers come down, we lose our trading in pork with international markets, and that would be really devastating to with the Northern Irish and Irish pig industry. So it's important that we keep exotic disease like African swine fever out and keep the export markets protected. We only have to look at the German wild boar case. The minute the international markets and countries got wind of the wild boar case, the export markets were shut down straight away. So the day after, I think South Korea banned the imports immediately from Germany after their wild boar case, and then China banned them. Japan was next to follow. And there were real questions and obviously concerns for Germany at the time as a large pork producer of the impact of losing the export market to international countries, but also the impact it has on the home market and the European market, that pork product will have to be absorbed by the internal home market, and that obviously impacts on pig prices across the board and internal trade markets. So certainly big impacts in the pig industry if external markets are closed down. And it takes a long time to regain that status, even if you're free of disease. It takes a long time for that trust to build up again with other countries to be willing to take products back again. So how is African swine fever likely to be introduced to the island of Ireland? I've already mentioned we don't have wild boar, thankfully. We don't have the ticks that carry African swine fever, but our biggest threat is it coming in either through international travel. Some people going to areas where they're on pig farms and areas that are infected and bringing it back on clothing or through equipment. But illegal pork products is probably our biggest threat, particularly personal imports. So people who go on holidays or go home for a break and then come back to Ireland and bring home with them home cured products that aren't eligible for being brought into the country, and they're bringing them in their suitcase or their luggage, and it's the risk that some of these pork products will get onto pig farms or pigs will come in contact with this meat material. Also the illegal commercial shipments of pork, etc., and how these might come in contact with pigs as well. How is it likely to spread if I get into the island of Ireland? The lack of any of strong on-farm biosecurity, and we can't emphasise the importance of biosecurity enough. As well as that, also small-scale organic producers or pet pig owners. And I suppose the risk with these types of herds is they may be unaware of the risk of ASF to the whole national pig herd if we got disease into some of these backyard pigs. And it's all about awareness and trying to get the message out there to people who maybe aren't engaged with the agricultural industry as much as obviously our vets and our pig producers are. So mitigating these risks, they can all be mitigated through strong on-farm and industry biosecurity standards and practices, and industry and government working together to mitigate against these risks. So through prevention and preparedness, some of the things to do in relation to African swine fever is obviously horizon scanning and risk assessment. So you saw the maps I showed you earlier. This is all built from our international disease monitoring teams. DEAR work very closely with our DEFRA teams, as do our colleagues in DAFM, and that's horizon scanning, looking at those disease pictures across globally and to see if there's an increase in disease in certain areas, how that impacts on the UK and the island of Ireland. We also have very strong import controls. So as well as the not taking pigs and material in from infected areas, the key thing is our action on the illegal personal imports and trying to target that area and trying to get the message out to international travellers. If in doubt, leave it out is our message in relation to bringing products back onto the island. A prohibition on feeding kitchen waste and meat to pigs, and again, that's the ban on swill feeding, and that's where they come again from the foot and mouth cases as well. So keeping that and getting that message out there, particularly to pet pig owners, that they shouldn't be feeding kitchen waste or meat to their pigs. And building that public awareness and those campaigns for international travel. We had recent ones for international students who might be bringing material from home as they start university life within the UK or in Ireland, and it's just to get that message across, not to bring product back with them, and again the message out to pet pig owners. We have controls at our airports and ports, so it's an example of our previous Ministers of Agriculture and one of our border inspection dogs that are trained to hunt out any meat that they detect within luggage from passengers. So the dogs would target international flights coming into Belfast at the airport, and that's to determine if there's any illegal personal imports in the luggage. This is an example of, and this isn't all meat, there's cheeses and various things, but it's just an example of some of the things that our staff at our border control posts will be finding and removing from people who are trying to bring the material in their luggage. So awareness campaigns across the board and the materials out there and online. OIE and the FAO have produced ones again to raise the awareness of how easily it can spread and can come back in clothing. Ourselves have reminders that we leaflets to be handed out, and again at our portal controls as well to raise awareness. We also have an agreement with the airlines to make announcements when flights land in Belfast, to remind people not to be bringing materials that are prohibited onto the island and to declare them. And likewise, DAFM as well have had a campaign in relation to the international the problem with bringing personal imports back and not to bring pork or pork products back onto the island of Ireland, and the message that diseases don't respect borders. So as well as those campaigns, there's also surveillance. So our regional labs play a vital role across the island, and always been aware of picking up any signs of a suspicious disease, doing postmortems, routine postmortems on pigs that are submitted. As well as that, there's abattoir surveillance is carried out. I know DAFM carried out abattoir surveillance in Cull Sows. Our contingency plans, as Anita indicated, about zones being set up in relation to blue tongue outbreaks, the same with African swine fever, disease control measures we have put in place. There would be various zones set up for surveillance, for testing, and obviously culling and disposal of infected premises. So we have those plans in place, and we work closely with our colleagues in DAFM to sort of north-south plans in place, particularly if there are disease zones that cross the border. And we also are fully aware of the interlinking between the pig industry across the island as well. So it's important we work together. And that collaborative working is not only important across government, but also with industry, so that we can think of ways to get the key messages out there, both to producers, to the small pig holders, and also we're working with industry in relation to their contingency plans for their businesses, so they can sort of streamline and look to see where they could compartmentalise within their business to protect certain areas of the business if they were unfortunate enough to get a disease outbreak within one of their pig herds. So really, biosecurity is a sort of key take-home message from this evening in relation to episodic disease and African swine fever. For producers, we can only say it so often, or can't say it too much about how you maintain strict biosecurity, but you're only as strong as your weakest link. And always thinking ahead, you might have everything in place, but if you've relief workers in at the weekend, is that when it dips and somebody's not following the protocol? Always making sure you only have essential visitors to your farm, ensuring they follow the cleanse and disinfection protocol and what footwear and clothing to wear. Having a visitor's logbook is important, so that if disease does happen, it's important that we're able to go on farm, be able to see who's been on recently and what has left recently, to see where disease might have went to from your farm. Only allowing vehicles and equipment on if they've been cleansed, disinfected beforehand, and not allowing people on your farm who've had contact with other pigs is important. Not allowing pork products onto the farm at all in case there's any way you could get into the pig feed. Not allowing any catering waste to be fed. And only sourcing pigs and semen of known health status. Again, making sure it's a reliable source where you're getting that material from. And we all have an important role to play, and certainly at a producer level, it's important that we maintain this effective biosecurity all year round. And as I say, it's important just always think of where the weakest link could be. And sometimes it's good to get a critical eye in. You might have good biosecurity, but sometimes you can get complacent or you miss things if you see it every day. So always involve your private veterinary practitioner to do a biosecurity assessment on the farm, to get a fresh set of eyes to look and see, well, you could be improving here, or you could think about more foot tips there, etc. And just have a critical eye over your current biosecurity measures. And as Anita alluded to as well, if you suspect disease, you should be reporting this to DAERA or DAFM, your local regional veterinary office during working hours and out of hours. Both DAERA and DAFM have emergency disease hotlines for you to be able to get in touch, so that a disease investigation can take place by one of our vets. So just take on messages of staying vigilant, maintaining biosecurity, and that will help to protect the industry. Thank you.
Thank you, Gemma. Thanks for that talk. I should probably have mentioned earlier that if anyone has any questions, there's a questions tab that they can be typed into inside. And just if we don't get to all of them this evening, we will have the details of who put them in, and we can reply directly.